Hey, it's Birdman for Summit Healthcare's today at the Birdman Media Studios, and with me I have Miss DeAnn Davies, or it's Mrs.
It's
Doesn't
Mrs.
matter. It's Ms. We'll say Ms. It's Mrs. Awesome. So, you're at the hospital. You're director for.
Early Childhood Outreach and Pediatric Psychology.
Yes, and I know I've talked to you because of I have kids,
Yes,
and that's pretty normal, isn't it, for people to want to know what's going on with their kids and seeing if things are right time and all that.
that's absolutely right. And it is normal for them to want to know. And we at Summit Healthcare are very dedicated to our families and give them evidence based research information about what it is their children know.
Very good. So today we are in to talk about something specific, and it has to do with kids, but not maybe kids specifically, and that would be.
Postpartum depression.
Okay, take us through what that is exactly, and then what you guys do to help with that.
Okay. The broader category is perinatal mood and anxiety disorders, anxiety being important as well as depression. And so we know that 1 in 7 women, and believe it or not, we also know that 1 in 10 men, shortly after giving a baby, experience some form of a mood disorder, including depression and anxiety or anxiety. And so we want to take a closer look at that. And all of the families who come through our Healthy Steps program in our Summit Healthcare's pediatric and family medicine clinics for their child's child care receive a screen to determine whether they are at risk for postpartum depression or anxiety disorder.
Okay, so on the female side, I kind of understand it. On the male side, is I guess it's a little sort of like I don't. Is it based around the fact that you don't get any sleep after you have a baby, or?
That's some of it, of
Okay.
course. Sleep is very important for everyone when you have a baby. But what we know about fathers is that new fathers become very anxious and they have thoughts of, oh my gosh, there's no getting out of this now. I now have a baby, especially their first baby. And they don't really have anyone to share that with because people say to them, "Oh, come on, you're going to be a dad. You can take care of this baby. You'll do just fine." And that's probably true, but fathers have anxiety around that. And anxiety can sometimes look like anger. So they can become angry all of a sudden after having a baby at a time when you think that they would be so happy that they just brought this little one into their family. But with that baby comes a lot of stressors.
So I don't know if it's evidence based or not, but I kind of believe that men talk differently than women, and it comes down to like we get shorter whenever we get anxiety. Or we get in a situation we usually get shorter and direct to the point, which comes off, I think, sometimes women as being angry, like you said, or aggressive. And yeah, and now you can see what you're saying. I mean, I kind of thought a thought in my background of what happens when you have a baby is all of a sudden now it's like I think when my kids were newborns, especially, and like the first few months you're like, are they breathing? Are they breathing? And especially at night when they're asleep and everything's calm, seemed to be the highest. When they were making noise and moving around and stuff like
Mhm.
that was all good. But when they were calm and like asleep, then it's like, are they okay? Are they okay?
And that's true. There is just so much to worry about as a new parent. And I think that that little being is 100% dependent on its caregivers for its livelihood, and to keep it alive is a huge responsibility for parents that most of us don't appreciate the pressure of that. And yes, dads have that too. And I think you're right that sometimes dads will become abrupt or become fussy, grouchy themselves, and uh, less patient with their partner and less patient with the baby. And dads have gone through a lot too. They had mom to themselves and now they're sharing with the baby. And let's face it, if the baby's breastfeeding, the mom has the baby most of the time because the mom is feeding the baby.
Right.
And in that comes a lot of nurturing. And from that can come a lot of attention pulled away from dad. And people get frustrated with that. But I think we need to look at that head on and say this is a life change for dads too. And
It
yes,
is.
dads communicate in a very different way than moms do.
And I would say that, if you don't have any emotional change after you've had a baby, there's probably there's something that's not normal. You're going to have some emotional change. I mean, there's ups and downs and
Yes,
all of that because first of all, it's a baby, so you're going to be excited,
right.
and with excitement always comes a crash back down to normal, which then feels lower than normal because you were just excited, and there's a lot of up and down, and then of course. You don't sleep much, like I said, because either the kid's keeping you up or you're keeping yourself up because you're stressing about the kid. So
Yes.
don't think you're broke.
No.
You're actually exactly right, and it's a good time to lean on somebody. So
That's
you're a
right.
resource to lean on.
We are. Healthy Steps is a fine resource for families to lean on. Moms and dads and other caregivers in the family can lean on us all they need to get them through. One of the things we talk about in a Healthy Steps encounter with families, new parents, is, how's this adjustment going? How's it going for you? We're not just talking about the baby because we know that, as Winnicott said, there's no such thing as just a baby and its caregiver. And I'll
Correct.
paraphrase that to today's world. He said mothers, but we know that fathers are
Yeah,
also
of
just
course.
as important.
Right. Yeah. I mean, it's funny because you go from one kid and you're sort of like, it's a small family. If you get two kids, you're like, they call it man on man defense.
Right.
You get three, you're in zone.
You know that as well as
Yeah.
anyone.
It's funny because three seems like one more than two.
Yes.
In reality, I think it's like 100 times more. I don't know why, but it's just like, wow.
It's interesting you say that. We do actually talk with first-time parents about the fact that, if you space the births of your children after 18 months, so you've had your first baby and then you don't become pregnant until your little one is 18 months of age,
Right.
that there are much better outcomes for the baby and for you, mother and father, and the family in general. So we do talk about birth spacing.
That's very good. Cool. Awesome. Anything else as far as, it's obviously they can go to the Summit Healthcare website to have access to your information and things like that.
Yes.
Where else can they go for resources and how else can they be in contact with you and your team?
They can call our team at 928-367-6550. We are located in Lakeside, right next to the Chalet restaurant in that medical complex. And you'll see it says Early Childhood Outreach and Child Psychology. And we have big banners on the window so everybody can find us. It says Healthy Steps in Child Psychology. And you can just walk in and generally somebody is there. The beauty of our team is that even our administrative assistant is certified to provide postpartum support services.
Very good.
So anyone that you encounter on our team will be able to hear you and tell you what this is all about.
Awesome. DeAnn Davies, obviously with Summit Healthcare. Anything else we need to know?
Just that we are going to begin providing support groups for parents. So you want to call us if you're interested or talk with your Healthy Steps specialist at your child's provider's office. If you don't have Healthy Steps as part of your child care, call our office and we'll give you the information. And everyone is invited to participate for free, no cost,
Very good.
for our group peer support, GPS parenting.
Awesome. Thank you very much again for your time today. Hey, that's going to be it for this episode of Summit Healthcare's. I'm Birdman reminding you, be healthy.